Hello and welcome to this important health update. I'm glad you're here today, because what we're about to discuss could quite literally save a life, maybe even your own. As we age, our bodies begin to show subtle signs that something might not be quite right. Some of these signs may seem harmless: feeling dizzy for a moment, forgetting a word, or stumbling slightly when walking. But in many cases, these are not just signs of aging. They may be early warning symptoms of something far more serious: a transient ischemic attack, or what is commonly known as a mini-stroke. Now, let me be clear, a mini-stroke is not mini in its danger. It's a red flag, a warning shot from the body that a major stroke could be on the horizon. These events often occur suddenly, last only a few minutes, and then seem to disappear, which is why they're so often ignored. But failing to recognize and respond to them in time can lead to devastating consequences, including permanent brain damage or a full-blown stroke within days. In today's video, we'll be discussing the top warning symptoms of mini-strokes that are commonly missed, especially in seniors. These include symptoms like sudden weakness, speech problems, visual disturbances, and more. While they may appear mild, or even pass quickly, each one is a critical sign that your brain isn't getting enough blood flow and that immediate medical attention is needed. It's estimated that nearly 1 in 3 people who suffer a mini-stroke will go on to have a major stroke within 90 days, and often within the first 48 hours. That's why early detection is not just important, it's life-saving. Whether you're watching this for yourself, for a parent, a spouse, or someone you care about, knowing these signs could make the difference between full recovery and long-term disability, or worse. The good news: with the right knowledge and fast action, strokes are preventable. Please watch this video all the way through. Each symptom we cover is explained clearly and simply, with guidance on when to seek help. And toward the end, I'll share a quick self-check tool that you can use right at home to assess if you or a loved one might be at risk. Let's get started with the first symptom, and remember, when it comes to stroke, time lost is brain lost. Don't overlook the signs your body is giving you. One of the earliest and most commonly overlooked warning signs of a mini-stroke, also called a transient ischemic attack, is sudden dizziness or a loss of balance. This symptom often comes out of nowhere. You might feel like the room is spinning, like you're walking on an uneven surface, or even like you might fall over without any clear reason. But here's the truth: if dizziness or imbalance appears suddenly, without warning, especially in someone over 50, it should never be ignored. Mini-strokes happen when blood flow to a part of the brain is briefly interrupted. That tiny moment of reduced circulation can affect the parts of the brain responsible for movement and coordination. When that happens, your body can instantly lose its sense of direction, posture, and control. That's why you may feel unsteady on your feet or like you're about to faint, even if you were fine just minutes earlier. As we age, the systems in our body that help with balance, like the inner ear, vision, and muscle control, begin to weaken naturally. But a mini-stroke can create a sudden and dramatic disruption in balance that's far more severe and alarming than typical age-related changes. It's not just aging, it's a neurological emergency. How to recognize it's not just normal dizziness. Did the dizziness come on quickly without explanation? Are you having trouble standing, walking straight, or reaching for objects? Do you feel like you're going to fall, even when sitting? Is it accompanied by other symptoms like nausea, slurred speech, or blurred vision? If the answer to any of these is yes, it's time to take this seriously. If you or someone nearby suddenly feels dizzy or loses balance without an obvious cause, don't wait it out. Sit down immediately to prevent falling, and call for emergency medical help. Even if the dizziness passes in a few minutes, that doesn't mean you're in the clear. A transient ischemic attack is a powerful warning sign that a full-blown stroke could happen in the next few hours or days. Sudden dizziness or loss of balance is not something to sleep on or wait out. It's your body sending a distress signal from your brain. The sooner you act, the better your chances are of avoiding long-term damage or even saving your life. Symptom number 2. Trouble speaking or slurred speech. Don't ignore this vital signal from your brain. One of the most telling and urgent warning signs of a mini-stroke or transient ischemic attack is sudden trouble speaking or slurred speech. This symptom may appear without any prior warning, and it can happen even if you were speaking normally just moments before. A person experiencing this symptom might struggle to get words out, may jumble their sentences, or begin speaking in a way that sounds unclear or garbled. Others may find that they suddenly can't find the right words, or they know what they want to say, but the words just won't come out correctly. This isn't just a moment of forgetfulness. It's a potential neurological emergency. Older adults often chalk up forgetfulness or jumbled words to age or tiredness. But in many cases, these may be mini-strokes in disguise. When someone has sudden speech difficulty, even for a few minutes, it's time to take action, not wait and see. Signs of speech trouble to watch for: slurred or slow speech that sounds drunk or muffled. Difficulty naming everyday, inability to repeat a simple sentence, speaking nonsensical words or using the wrong words, sudden confusion during conversation, struggling to follow or respond to basic questions. If any of these happen suddenly, especially in someone over 50 or with high blood pressure, it's a red flag. Don't ignore it. If you notice speech problems in yourself or someone nearby, note the time and call emergency medical services immediately. Medical teams may ask you when the symptoms began. That timing helps determine treatment options. Remember, even if the symptoms disappear in 10 minutes, the risk hasn't. It's a warning sign of a larger stroke to come, often within hours or days. When a mini-stroke occurs, the brain may lose temporary blood supply in the areas responsible for language and speech, usually on the left side of the brain. As a result, the brain's ability to form coherent language is interrupted. This disruption might last for just a few minutes, but even if speech returns to normal shortly afterward, that short-lived moment could be a critical warning that a full stroke is coming soon. Speech is one of the most important functions of the brain, and it's also one of the first to be affected during a mini-stroke. Please don't ignore slurred, slow, or strange speech, even if it's brief. The risk of a major stroke is highest, and fast action saves lives. Symptom number 3. Weakness or numbness in the face, arm, or leg. Especially on one side. When it comes to identifying a mini-stroke or transient ischemic attack, one of the most classic and urgent signs is sudden weakness or numbness, often affecting only one side of the body, typically in the face, arm, or leg. This symptom is not random. It's your brain's way of saying something is seriously wrong. Let's break it down. A mini-stroke occurs when blood flow to a specific part of the brain is temporarily blocked. When the affected region is responsible for controlling movement or sensation, you may suddenly feel weak, heavy, or numb in your limbs, or even experience complete loss of function on one side. This often involves the right or left side of the body, depending on which side of the brain is involved. The reason it affects one side is because each side of your brain controls the opposite side of your body. So, a blockage on the left side of your brain can affect the right side of your body, and vice versa. What you should do immediately. If someone's face appears uneven, ask them to smile. A droop on one side is a red flag. If one arm suddenly feels weak or numb, ask them to raise both arms. If one drifts downward, call for help. If one leg is dragging or unresponsive, don't wait to see if it improves. Call emergency medical services right away, even if the symptoms improve in minutes. The quicker you respond, the better the chances of recovery and stroke prevention. Don't drive yourself to the hospital, call an ambulance. Common signs to look out for: a sudden heaviness in one arm or leg, inability to lift or grip with one hand, drooping on one side of the face, especially noticeable when smiling, numbness, tingling, or pins and needles sensation in one limb. dragging of the leg, or difficulty walking on one side, arm or leg, giving out unexpectedly. This weakness, or numbness may come on suddenly, and without warning. It might last just a few minutes, or it may fade before the person even realizes it happened. But regardless of how long it lasts, it's a neurological emergency. Many older adults assume that feeling weak or numb in an arm or leg is simply due to sleeping wrong or getting older. But sudden, one-sided symptoms, especially in the face or limbs, are among the most well-documented warning signs of a stroke or mini-stroke. One-sided weakness or numbness is not something to ignore. It may be temporary, but the consequences of overlooking it could be permanent. The faster you act, the more brain function you can save. Don't assume it's nothing. Get it checked. Every minute matters. Symptom 4. Blurred, or double vision. When your eyes signal trouble in your brain, vision is something many of us take for granted until something suddenly feels off. If you ever experience blurred, double, or dimmed vision without warning, it could be a major red flag, not just for your eyes but for your brain. This is especially true for seniors. Blurred, or double vision is one of the early warning signs of a mini-stroke, or transient ischemic attack, and it often gets dismissed as simple eye strain, fatigue, or age-related vision changes. But when this symptom comes on suddenly, it could mean a temporary blockage in the part of the brain that controls sight. Our vision naturally changes with age, but a mini-stroke causes abrupt and unusual changes that you don't expect. If you're watching TV and suddenly everything goes out of focus, or if one eye goes dark, or if you're seeing two versions of everything, it's not aging. It could be a brain-related warning. Some people report seeing flashing lights or shadows. Others feel like a curtain came down over part of their vision. Even if it clears up quickly, don't assume it's harmless. That may have been a warning sign that a major stroke may be coming soon. What should you do? Stop what you're doing, especially driving or walking. Sit or lie down safely. Call emergency medical services immediately. Make a note of the time the symptom began. Doctors need this to determine your treatment options. Even if your vision returns to normal within minutes, it's warning you a full stroke may be next. Blurred, or double vision is not always a problem with your eyes, it can be a problem in your brain. If you're over 50 and above, and experience this symptom suddenly, don't wait. Get help immediately. Symptom 5. Sudden severe headache, with no known cause. Everyone gets headaches now and then. But when a headache comes on suddenly, sharply, and without an obvious reason, especially in older adults, it may be far more serious than simple tension or fatigue. A sudden, intense headache that feels like the worst headache of your life can be a major warning sign of a mini-stroke or transient ischemic attack. It might also signal the early stages of a full-blown stroke. Unlike normal headaches that build up gradually, this kind of pain often hits like a thunderclap. What you must do immediately: sit or lie down. Avoid taking aspirin unless advised by a doctor, especially if there's a risk of a hemorrhagic stroke. Call emergency services without delay. Take note of when the headache started and any other symptoms that followed. Even if the pain disappears quickly, you must get a brain scan to rule out stroke or bleeding in the brain. Your quick action could prevent permanent damage or even save your life. During a mini-stroke, blood flow to a part of the brain becomes blocked for a short time. When this occurs near areas involved in pain processing or blood pressure regulation, the result can be a rapid onset headache, sometimes with pressure, sharp pain, or burning sensations. This headache is not like your usual one. It may come on suddenly and severely, be localized to one side, be accompanied by nausea or vomiting, come with other symptoms like blurred vision, confusion, or difficulty speaking. In some cases, people describe the pain as bursting, pulsating, or like being hit with something heavy. Even if it fades in a few minutes, that does not mean you're safe. A mini-stroke might just be the beginning. As we age, we become more prone to conditions like high blood pressure, atherosclerosis, and diabetes, all of which increase stroke risk. Seniors often downplay headache symptoms or treat them at home with rest and water. But a sudden, intense headache, especially when it's new or different, is a medical red flag. Mini strokes may resolve in minutes, but they are warning shots. If a headache feels sudden, sharp, and unfamiliar, it's time to get help, not wait, not guess, and definitely not sleep it off. A mini stroke doesn't always come with dramatic symptoms, but this kind of headache can be its loudest cry for help. Mini strokes, also known as transient ischemic attacks, are often silent, brief, and easy to dismiss. But make no mistake, they are serious medical emergencies. They are not random accidents. They are early warning signs that your brain is trying to tell you something important. A full stroke could be coming, and soon. The 5 warning symptoms we covered today: sudden dizziness or loss of balance, trouble speaking or slurred speech, weakness or numbness on one side of the body, blurred or double vision, sudden, severe headache with no clear cause. May seem unrelated at first glance, but together, they paint a clear picture that something is wrong with blood flow to the brain. Many seniors ignore these symptoms, thinking they're just tired, dehydrated, or getting older. But that mindset can be dangerous. The truth is, every second counts when the brain is involved. Ignoring a mini stroke is like ignoring smoke before a fire. It may seem small now, but it can lead to devastating consequences. Mini strokes are temporary, but the damage they warn of can be permanent. Statistics show that up to 1 in 3 people who suffer a mini stroke will have a major stroke, and half of those happen within 48 hours. This is your chance to act early. Don't miss it. What should you do if you notice any of these symptoms? Call emergency medical services immediately. Don't try to drive yourself or wait it out. Take note of when the symptoms started. Get to a hospital where a brain scan and stroke evaluation can be performed. And even if the symptoms disappear quickly, always follow up with your doctor for further evaluation, blood pressure control, and possibly stroke prevention medications. Let this be your encouragement today. Faith and action work best when combined. God gives us signs, but it's up to us to respond. Your brain is one of the most vital organs in your body. Don't wait for something to go terribly wrong before you take action. If you or a loved one experiences any of these 5 symptoms, even for a few seconds, treat it as a warning. Act fast. Get help. Protect your future. Thank you for watching. If you found this video helpful, please like the video, share it with your family and friends, especially seniors. Subscribe to our channel for more life-saving health tips and senior wellness updates. Stay alert, stay healthy, and may you always walk in wellness and wisdom. See you in the next video.